The healthcare industry has lagged behind every other industry in adopting HIT, and it's held us back, it's cost us money. It is way past time to start doing this. The Alabama Regional Extension Center, or ALREC, is an organization that is federally funded to help physicians across the state of Alabama adopt electronic health records.
One thing Alabama has always done as statewide health information technology initiatives is to be inclusive. We invite lots of people to the table to be part of the leadership and decision-making process. So we implemented that with the Alabama Regional Extension Center as well, inviting provider associations, the Alabama Hospital Association, public and private, universities, other state organizations, state agencies, to all be part of the leadership and part of the decision-making process. And that's really helped us gain traction.
Critical access and rural hospitals are in dire need and have no money to do this. So the federal program that ALREC is funded by offers incentives to healthcare providers to adopt electronic health records.
Our practice is a family practice in a rural town in Lower Alabama, Jackson, Alabama. We have about 6,000 people in the town, and we serve the surrounding areas. But we knew we had gotten to the stage that we had to make a change. We had no more room to put paper charts. Paper charts were everywhere, and we were continually losing charts.
As an implementation specialist, I help providers in Alabama adopt electronic health records and achieve meaningful use. This is extremely challenging for them. And so we really try to keep that in mind when we go through the whole process.
Michelle is almost like she was an employee here at the office in a good way. I mean, she was here when we needed her. We could call her whenever we had a question or any concern. She wasn't overbearing. She was there as kind of a coach and also a cheerleader and also an area of expertise also. So it was a real symbiotic relationship which we both worked well with together.
In Alabama, the key to everything is the personal relationship, building trust with people. They have to get to know you and get to trust you. And it doesn't take a long time to do, but it's a skill that you need to have if you're going to succeed with people here in Alabama.
Without the help of the Alabama Regional Extension Center, it would have been hard for us to get to meaningful use in the time frame that we did.
Meaningful use is a term used by the federal government to describe the use of an electronic health record system provider that is synonymous with being eligible for incentive payments. However, real meaningful use is longer lives, less medical errors, reduced costs for the overall medical system. That's really what it's all about.
Mobile OBGYN is an 8-physician practice in Mobile, Alabama, specializing obviously in obstetrics and gynecology. And we have about 50,000 patients on our rolls and deliver about 1,400 babies a year. Before we were doing electronic medical records, we were dictating all our charts. And we've been doing it for quite a while. And like anything you do for a long time, we were good at it, efficient at it, and I felt like it was a good thing to be doing it that way, and was not really excited about the fact we were going to electronic medical records. What happened is 6 months into it, I realized I was getting out of work an hour, maybe 2 hours earlier than I was when I was dictating. That at the end of every patient encounter, all of my documentation was done, all of my prescriptions were done.
I love to see the providers getting the benefit of the system and being happy about it. Because when we started down this road with Health IT back in 2009, all the naysayers said, oh, doctors will never accept this. Doctors hate IT. It's too expensive. It's this, it's that. They're never gonna, well, they should come down here to Alabama because doctors love it.
As the president of the Alabama Rural Health Association, what I want to emphasize is how important it is to get care to the level of the people. People live not in large hospitals, not in large cities, but they live in small communities. And I think the beauty of ALREC is they're working with small practices, small doctors, and trying to get them connected, which is so important when we try to deliver better health care in a state that has a lot of fragmented care.
A lot of people don't understand really what the mission of ALREC is if they don't know us. They think that we're trying to sell them something. They think that we're trying to sell them a product, but that's not what we're selling. We're selling an idea. And the idea is to make practices more efficient, more modern, better able to understand the health of their patients by using electronic health records.